Hi, my name is John Bosworth. I'm a licensed mental health counselor in St. Petersburg, Florida. I'd like to talk to you a little bit about the types of dual diagnosis. Dual diagnosis, again, is a concurrent mental illness with some form of substance abuse or substance dependence. Some of the types of complications or disorders that arise from being included in a case of dual diagnosis could be, first one that we really think of with dual diagnosis is chemical dependency. That can be alcohol or other drug use. The complications there are some people will just treat the substance abuse and not really treat the mental health illness, which makes it more likely that the person would actually relapse on the addiction side. Chemical dependency is one type of dual diagnosis. Eating disorders are another type of dual diagnosis. Many times anorexia or bulimia or binge eating coincides with some form of chemical dependence or substance abuse. And the reason for that is many times when people are involved with some type of eating disorder, they have certain psychological or mental processes that may be irrational in nature. So a lot of times they're not feeling very good. They might be feeling anxious or depressed, and you hear people say when they're binge eating that they ate because they were depressed or whatever. So we really need to look and be careful about treating both sides there also. Two other types of dual diagnosis that aren't mentioned much are chronic pain and trauma. Chronic pain, it's pretty self-explanatory or pretty obvious when you look at chronic pain that many people take some type of narcotic or opiate for the relief of the actual pain. So a lot of times tolerance builds up, and you can also have an addiction to the opiates in addition to the chronic pain. Trauma, the last one that I'd like to talk about, can occur in addition to an existing substance abuse condition, or it can actually start a substance abuse problem or a chemical dependency problem because of the high levels of anxiety that most people experience with some type of post-traumatic stress or traumatic incident. My name is John Bosworth, and I've been talking a little bit about the types of dual diagnosis.